Good afternoon, everyone, and thank you for joining today's RCPCH Live CYP COVID-19 Q&A. Now, that's a lot of acronyms, and I know what you're thinking, but fear not. The webinar will feature young people from RCPCH and Us, our network for children and young people. On board, we've also got the College Registrar, Dr. Mike Linney, the Chair of the Trainees Committee, Dr. Hannah Jacob, RCPCH member, Dr. Jas and our cool, edgy engagement manager, Emma Sparrow. If you're not wowed already, here's a taste of what's to come. The session will start off with a short introduction from Mike Linney on the college's response to COVID. We'll then hear from each speaker with time for questions after each one and some time at the end for any extras. To send us a question, comment or idea, on the right of your screen is an Ask a Question tab, which you can use at any point during the live Q&A. Here's Emma to explain what we'll do next.
In all of our sessions with And Us, we always have a reminder of how to have a great and safe session. Today, we want you all to listen, get involved, feel safe and supported with us. So the slide basically describes how to have a safe and supportive meeting, how to look after each other, how to share your views, and how to get support after the meeting if you need it. Please don't worry about recording the session as it will be going on YouTube after. I would now like to introduce Mike Linney.
Yeah, so again, thank you, Emma and Michael, and thank you, Emma, for inviting myself and Hannah and Jas and teams to come and talk to you. And it's a delight to be talking to the RCPCH and Us crew from the RCPCH membership. That is just brilliant. So what we're doing today is we were asked to discuss this topic, and we really wanted to follow up that with a short session of us talking, but lots of time for questions and answers. So please, as Michael said, get typing in that chat box and let's have a sort of a good discussion on this. So as myself, I'm a paediatrician working in the south coast of England, and like you, when COVID came, we were all affected. So if you look at the next slide, please. So what we're going to say is, just have a think, everybody. How did COVID change you? It certainly changed us. And I don't know when the first time you noticed the differences, but we got them very early on. We struggled because we couldn't meet you in clinic. We couldn't bring you to hospital if you needed a routine operation because we're told to keep everybody away from hospitals. You were told to stay at home. This made many people really worried and scared. So often people stayed away from hospitals. And you may have noticed that your local doctor was less available. So when you were unwell, you may not have been able to see him. So all these things happened together. So what did this lead to? So if we look at the next slide, please. So because people weren't coming to hospitals, because actually people were very well during the COVID, we did not get a lot of children admitted with COVID infection. So we were left with hospital rooms like this. Really quiet, very unusual. And what happened was that a lot of our doctors, a lot of the paediatricians went into adult medicine, but also other areas of the hospital were very busy. Other parts of children's hospitals were very busy. And Jas will talk to you about that and what he experienced during the really busy period in the pandemic. So why were the wards quiet? Well, it's a good thing because children were very well, so weren't coming up. But more worryingly, we think probably children who we needed to have seen couldn't come up there. So children needing routine operations, children needing their standard care didn't come to hospital. So what do we have to do about that? Next slide, please. So we have to think about how could we help you? How could we get a system going so that when you were at home, we could actually provide your health care? How could we respond to this? So we had to think of ways of reaching out to you and also using your ideas so that you come to us as well. So we look at the next slide, please. We had to think about two things. We wanted to make sure that you knew we were still here for you. And that's always going to be the case, no matter what you hear in the media, no matter what else is happening in the world. Your children's doctors, somebody just dropped something. Well, our children's doctors are always going to be here when you're needed. Don't be scared to come and see us. We also need to make sure that you've got good advice when you're unwell. So we put advice out to your families so they could assess if you need to see if you were unwell, what you could do. We also spoke a lot to our GPs as well, so they could do the same thing. So all the healthcare came together to find ways of looking after you. And the second thing we had to do was actually to make sure you were well. How could we check on you when you're at home? So many of us set up virtual clinics, and this is a picture from one of my virtual clinics, and this is the CF team by Lego, and I'm the third one on from the left-hand side in the white top with the glasses. All my patients recognise me straight away. I don't know why that was the case, but we had to be available, and that helped us. But we know that virtual clinics have got some drawbacks as well. So there's a really good way of meeting you at home and talking to you at home. But sometimes when you need those difficult conversations or quiet conversations, it's not quite set up for that. So we need to do more on that. I want to make ourselves more accessible, not just to you, but to everybody, to the community nursing teams, to general practice. And we learned quite a lot from that. We learned how to work better as a full service. So I'm going to leave you there for a short time. And I want to introduce you to Jas, who's one of our paediatric trainees who worked very hard on the front line when all this happened. So over to you, Jas. Thank you.
Thank you. Thank you for inviting me to share some of my personal and professional experiences as a paediatric trainee working during the COVID-19 pandemic. In the early months of the pandemic, thankfully, it became clear that children and young people weren't being affected in large numbers like there had been in the adult population. However, there have been a handful of children and young people who have become unwell and needing to stay in hospital because of coronavirus. There have been big teams of very dedicated, knowledgeable doctors, nurses and other healthcare professionals looking after these children and making them better. Some of these children have been cared for at Great Ormond Street Hospital, which is where I've been working for the past few months. My job, however, is been working on the renal ward called Eagle, which specialises in looking after babies and children who have problems with their kidneys. I work as part of a very big team with some very experienced and expert consultants and nurses. Some of these children take medicines which need to be adjusted regularly, some need dialysis, and some have had a kidney transplant and are taking special medicines like immunosuppressants. As a result, they need to be extra careful about becoming unwell, as their body may not be able to fight off an infection. And that's meant that doctors, nurses, and everyone who works in hospital is being extra careful about keeping everything clean and reducing the chance of spreading an infection. As a result, there have been many changes in the way in which we now work, and that's what I wanted to speak about. Many of these things you may have seen or heard of, like wearing a face mask all the time and social distancing. This has meant that our office space has been redesigned to limit the number of people in the office at any given time. It's also meant that the hospital practice has changed. We've cohorted patients who've confirmed to have had the virus together. It's also meant that we're mindful of how many doctors and nurses are going in and out of each room to see the patients during the ward rounds and throughout the day, irrespective of whether or not they've got COVID. One of the big changes that we've seen has been a shift towards telemedicine or virtual consultations, and Dr. Mike spoke about that a few moments ago. Rather than inviting the patients into hospital for their appointment, doctors and nurses are instead making video calls and phone calls. They can then decide if the patient needs to come in and if they'd benefit from being seen from face to face. Before bringing the patients in, though, we're asking them a series of questions to further reduce the possibility of an infected individual attending hospital. I trained over 10 years ago to become a doctor, and this technology of video conferencing was a relatively new thing and underutilized, but I think that this is going to become the new normal. This technology is great, but one of the most enjoyable parts of my job is meeting children and young people in person and getting to know them and what their condition and illness means to them. I suppose you can think of speaking to your friends on the phone or on FaceTime just isn't quite the same as meeting them in person, and that's going to be a real shame. Great Ormond Street has been fantastic. It's been making alternative provisions for delivering teaching and education to trainees like myself. In days gone by, the training would have been face-to-face, but now technology is played its part with platforms such as Zoom and Microsoft Teams being used on a regular basis. The same goes for multidisciplinary team meetings, these two have also shifted to going online. Much of the communication between the teams has been over the phone and via email. I'm sure that in the future, clinical teaching will also be adapted to become compliant with policies to limit the spread of infection. Much of the conversation in the mainstream media is focused on the impact of coronavirus on adults, in particular on their health needs and changes to their working practices. It's a shame really that the voice of the children and young people hasn't been heard. And for that reason, I'm all the more thankful that webinars such as this gives the opportunity to hear the voices of children and young people so that you can share your concerns and we can evolve in the conversation and champion your cause. Speaking to children and young people who have met at work has been really insightful. For some children, they're concerned about potentially becoming unwell from coronavirus, particularly those of you who already have underlying health conditions. I wanted to reassure you that becoming seriously unwell from coronavirus is thankfully a rare occurrence. And that's not to detract from the large numbers of adults who have become unwell or passed away as a result of this terrible disease. Some of you in the audience may have friends or family who've been affected by this or have become unwell, and I wanted to emphasize that there's always somebody out there that you can speak to if you are worried. Children and young people do more than just go to school. I know that going to school is an opportunity to learn, to play, to socialize with your peers. Being at home for many months will not have been easy, and some children and young people that I've spoken to have explained that they felt really, really bored. They've described that it's difficult to do the classwork without the help of teachers. Some have said that they feel really anxious and that they will no longer be sitting exams which they've studied many months for. On a personal level, I was concerned about working in a hospital and potentially spreading an infection to my family. In that context, I moved away from home for the past 4 months. I've also become healthier by commuting to work on a bike rather than taking public transport. The coronavirus pandemic, I think, has forced the government to prioritise healthcare, and we can see that with funding for infrastructure and human resources after countless years of not having the funding which it needs. We've been forced to change our practice as doctors and adopt new technologies such as Zoom, Microsoft Teams, and FaceTime in order to communicate with our patients. I think coronavirus, amongst many things, has been a catalyst for change and will force improvements in the way in which we treat our patients. The past 4 months, I think, has been an extremely difficult time for everyone. It's been a rollercoaster of emotion, especially a worry of how things will be in the future. Hearing the public clapping for carers has been a great thing. It's reminded me of how thankful everyone is for the NHS and how proud I am to work for such an organisation. It's been comforting knowing that the whole NHS and the whole of the scientific community is united around the world in trying to study the virus to see how it can be treated and defeated. Thank you.
Thank you, Mike, for setting the scene, and Jas for describing your frontline experience in a hospital and even ward that I know very well. For those of you who have recently joined the webinar, it's now time for the first Q&A session. A reminder that questions, comments or ideas can be submitted on the Ask a Question tab on your screen. We'll take as many questions as we can with a short slot after each presenter and then for a bit of time at the end for any extras.
So the first question is for you. So what did you learn from your work during your time during COVID-19 that you would want to keep going and doing in the future?
I think that medicine is a wonderfully collaborative job and career. I think that it's become even easier during coronavirus to speak to people, and I hope that we continue that in the future. So it's made me realise how easy it is to get hold of people just down the other end of the phone. Teams are communicating more efficiently with one another through emails. So I think that's what I'd like to keep in the future, those open channels of communication. Similarly, in the past, it's been difficult to always attend teaching sessions, but now it's really easy. A lot of our teaching and stuff is being recorded, so we can access them at a later date. So if our clinical duties are taking precedence over our teaching at any given moment, we can always go back and revisit that.
Sounds like, I think some of that comms stuff, so people being able to talk to each other easier, has also been something that young people have said that they valued as well. But equally, I think for some of them, it's also been a challenge. So it's interesting hearing both sides. Mike, we've got one for you. So unmute yourself and get ready. Do you think that young people are really less likely to get COVID? And if so, and what happens if they get it and then give it to their families?
Okay. Really good questions. So I've got really good questions. So, and those are things that many people, many scientists in this country around the world are investigating. If we know that children probably do get it the same amount of time as children, maybe less, but actually their symptoms are much milder. So over the real peaks of the COVID pandemic, hospital admissions of children with COVID was around about 1,000, 1,500 altogether. The vast majority mildly unwell, very few seriously unwell. And actually, during the COVID pandemic, children as a whole were healthier than they normally are during that period. So they weren't affected in the same way. And it's a really good question to ask, because I know we all feel this, and Jas mentioned it as well about the risk of passing it on to our friends and families, particularly thinking about elderly relatives. We are all at risk of passing on COVID if we get it. It probably is the case that children are less likely to pass on COVID. All the evidence we've got so far is when there's been an outbreak, we tend to source it to the adult members in that group as opposed to the children. So we can't relax on this. So it's very important that we follow the advice that's being given and follow the government advice. But actually, in this situation, children as a whole, in summary, have a much milder disease, much less infected, and actually, in terms of passing it on to their families and friends, they're less likely to do it, perhaps, than older people are. Thank you.
Thanks, Mike. And I think just so that everyone knows, at the end we're going to share some support links, because as Jas mentioned, it can be quite nerve-wracking or make you a bit anxious as a child or young person as to know where to go for support if you want to talk about this. So we have pulled together some of those links that we'll share at the end too. Thanks both of you very much. I'm going to introduce now Dr. Hannah Jacob, who is going to share her reflections, particularly about school and mental health in connection with COVID.
So hello everyone, thank you very much for having me. We're hopefully going to see a video shortly, but I'd just like to start by saying, so I'm also a children's doctor, and like Jas, I am also in training. So I think that the last few months have been quite a roller coaster for all of us. And as Emma said, I wanted to talk a little bit about school and about mental health. I think just while the others get the video sorted, the first thing I really want to say, which I think echoes some of what Jas said, is just a massive thank you to you all, because I think it would be easy to underestimate the sacrifices that children have made over the last few months, really on behalf of all of us. And in some ways for adults, actually lots of adults have been working from home, and they've often been enjoying not having to rush around so much, whereas for children that's often meant people have been quite isolated. So the first thing to say is just the most massive thank you. Oh, we might be able to see the video now, but I'll keep talking while it gets going. So yes, thank you very much. Here we go. Very grateful to you all, and I say that on behalf not just of children's doctors, but I think really everyone working in child health, and to be honest, all adults, because actually you have done us all a massive favour by staying at home. As Mike said, we know that actually children are probably less affected by COVID-19 than adults, and so it's even more impressive that you all stayed at home and you know, did lockdown to keep the rest of us safe. The two things that I wanted to focus on, I'm hoping that the video will appear, but I will just keep talking. The first thing is just a bit about schools. So I know that obviously you weren't able to go to school, and I think that was a massive sacrifice on your behalf. Lots of children and young people that I've spoken to found it really hard, as Jas said, to do schooling without much support from their teachers in some cases. Hard because maybe they don't have any Wi-Fi or they don't have devices. Hard because there might not be anywhere at home, any space at home to actually do the work, and you're contending with your siblings and all the rest of it. I think lots of young people felt quite isolated from their friends. And also, I think for some young people, actually being at home was really hard. Parents' tempers were frayed, maybe, and there were lots of concerns about money and people's mental health. Oh, look, you're getting the video in snapshots. So, as I said, thank you. You couldn't go to school, and doing schoolwork at home was tricky. I think the other thing that lots of children and young people, and again, I'm conscious has mentioned this and described to me when I have come across them at work, is just what a massive toll it's taken on their mental health. And I think, you know, that's no surprise really, that really overnight you were suddenly asked to not go to school, to stay at home, to not see your friends, and suddenly to be a lot more reliant on technology. And it's one thing having your phone and being able to contact your friends, but when that's the only way you're able to contact them, that's really, really hard. And actually, some stats. So 83% of young people in one survey, people who'd had previous mental health experience, said that lockdown had a negative effect on them. And I think even for those children and young people who perhaps hadn't previously had contact with mental health services, actually that degree of isolation is really, really tricky. Interestingly, in terms of the stats, apparently only 17% of children and young people were happy that exams were cancelled. So although we all whinge about it, actually it turns out that secretly, I think probably because it's an important rite of passage and something that you expect to have to do, and especially when you've worked so hard, you feel like you want to do the exam to get the credit for all your hard work. Lots of people describe enjoying having spent time with their family during lockdown, and I guess, you know, that's true for lots of children. So 92% said that they'd enjoyed spending time with family during lockdown, but I'm very conscious that that leaves 8% who hadn't enjoyed spending time with family, and indeed even within that 92% probably there were times when it was easier than others. I think the key message from our point of view, and you can just see that down at the bottom, is just particularly around mental health, but also around any worries that you have about going back to school. There are lots of really excellent resources online, which we can put together in the resources at the end that will give you a bit more of an idea about ways that you can look after your mental health, and indeed the mental health of your friends, because you'll often be worried about others of your friends. And the other thing to say, just from the point of view of children's doctors and children's nurses and your GP, is that we're all very conscious of the sacrifice that young people have made, and we really, really would urge you, if you have worries, to talk to your teachers, talk to your GP, talk to your paediatrician, because actually we want to hear from you. And if there are things on your mind that are troubling you, I think it's really important that you feel able to reach out, and we're all very conscious of how difficult the last few months have been. So I think, as Mike said, services are open. We absolutely want to support you, and sometimes it's not going to be perfect because we might be having to do a phone or a video review instead of getting you to clinic, but we're listening and we really want to hear from you. I'm very sorry that we haven't been able to make the video work, but hopefully we'll be able to send it around to you afterwards, because it's got some excellent artwork that I can't take any credit for.
Thank you so much, Hannah, for sharing your experiences. It's amazing to hear about how, firstly, COVID is affecting us, but also therefore how paediatricians are adjusting. And I know that many of my friends have found the entire process sort of unusual and strange, and they're still adjusting. So thank you so much for your answers. We have even more questions for you to answer. The Q&A has been on fire, so I'll let Emma read some of those out.
The first question is that's come in. So we've had some young people that couldn't take part today, and they emailed in some questions. So the first one is, how will children with long-term illnesses stay safe while they're going back to school?
Okay, it's a question that comes up quite a lot, and I think that there's understandable anxiety, particularly for people who might have long-term conditions and worry about going back to school. The first thing to say is that your school will be absolutely, our teachers, your head teachers, all the people that work in your school will have spent a lot of time over the last few months thinking really hard about the best way of working things out at school to make sure that you guys are as safe as possible. Now, different schools are going to do that in a slightly different way. Some schools have talked about potentially having young people stay in a classroom and teachers move around. most schools have got some way in which as you enter school you can sanitize your hands, and that there's more washing facilities around the school. And I think that the short answer to the question specifically about people who are very worried about going back to school is actually that we, as Mike said, there's very good evidence actually now increasingly that children seem relatively not to suffer so badly with COVID-19. So I think doing all the sensible things that we're expecting everyone to do. So if you're going to school on public transport, wearing a face mask, making sure that you wash your hands, making sure that where possible you stay distant from other people, and that actually going to school is not particularly, we don't think, particularly associated with increased risk, even for people with long-term conditions.
Thank you. And another one's coming about whether teachers should be wearing face masks, but also whether young people should be wearing them when they're in school.
Yeah, so it's been discussed quite a lot, and the evidence probably doesn't support young children and young people wearing masks at this point. I know there have been some schools that where individual teachers have opted to wear masks. And we think at the moment that the wearing of masks is mainly to protect others rather than to protect you from the virus. But at the moment, the advice is that you don't need to be wearing masks actually at school.
Thanks for that. We are getting other questions in, and I've put a note on the question box about the fact that we will take some of these at the end as well if we've got enough time, but also as a team we'll make sure that we summarise the key themes and then publish those with the link, with the slides, with the videos all online, so that people can have a look through as well and follow that way. So I'm going to hand over, thank you very much, Hannah. I'm going to hand over to Emma.
We set our RCPCH and Us team a challenge. Here are some of the views and experiences of other young people working with RCPCH during the lockdown.
So we've got one more video coming up, and we're having great fun with our videos so far. So we're all crossing our fingers behind the camera to see if that video loads and plays. But just so you know, just while we wait for the video to come up, we did some work for Paediatrics 2040 towards the start of lockdown, where we went round all over the UK. And as we've heard, virtual means that we can do that without travelling. So on one day I was in 4 different places, but we asked what they thought about lockdown and how it was affecting them. So let's see if this video plays to share some of their views and the views of the COVID-19 CYP book club. Just while we wait for the video, you've got to love the tech. So we had 57 young people that took part in 9 online sessions. They shared their common hopes, fears, worries and anxieties about health services and COVID. They also talked about messaging. They also talked about whether there was something that we could do different.
I thought okay at the start, but then as we got into it wasn't so great. Lockdown meant things changed for me, like dancing on Zoom instead of London, because usually I take a train to London. I want taking a train to London to definitely change back. Some things don't have to change, like eating at my mum's, because usually I eat at my childminder's. Going back to school makes me feel really excited, but also nervous and scared. Going back to London on the train makes me feel super happy, and when I found out, I was so excited.
During these uncertain times, I, like many people, have been adapting through different means of technology. Due to the pandemic, there have been even more surveys and questionnaires online. When it comes to young people, various results have shown they're worried about their future. However, what 80 or 90% of people say may well be important, but we need to acknowledge everybody's experiences. COVID-19 has affected us all. Some young people's worries centre around environmental concerns or the impact of society long term, but others think the main problem could be the criticism of political parties as a result of the crisis. What services should prioritise now is taking advantage of a time where technology is being forced to develop to its very peak. They should look at smaller percentages, minority views, and this will help us to help them, to then help everybody, as we discover more, not just about the virus, but the continuing daily impact it has on us all. We need to work together, and with young people at the heart of the research, we will already be on the front foot.
And from the reports that I've been reading so far, I've seen that across all areas, lockdowns cause a small but quite noticeable decline in the well-being of children, and in the specific report that I'm looking at from the Scottish Children's Parliament, it says that this is particularly true for girls. So what I think needs to be prioritised in the next 6 months ahead of lockdown, I think children's mental health services are key, because we have been seeing a decline in mental well-being. Fewer children are generally feeling cheerful and in a good mood, and also reporting that they have less energy. But I also think ensuring that every child has someone to confide and to speak to is also very important, because while most children are reporting that they have someone, there's a significant number that indicate they have no one to talk to. So yeah, that's what I think needs to be looked at in the future.
Some of the things which I've experienced during lockdown, and that I'm aware that other young people are experiencing too, is a sense of isolation from friends and family, boredom and worries about the future as lockdown restrictions are eased. Reports of young people's experiences also highlight how lockdown has had a negative impact on many people's mental health and well-being. However, I have, like others, been taking some time to reflect on the positives of lockdown, especially having more time to devote to my hobbies and getting to spend more time with my family. I think that the main thing which services need to focus on, whether that be the government, health services or schools, is ensuring there is more targeted communication specifically for children and young people. So a lot of young people are worried about schools, their health and the health of others, and feel like communications about COVID are mainly aimed at adults. I therefore think that some more detailed and targeted messaging specifically addressing these worries would be really beneficial to the majority of young people.
I've been shielding for the past 4 months as I have had a kidney transplant. I don't think many are aware there are lots of young people having to shield, as the emphasis has been on older people. It is really important to listen to young people during a crisis, as we all have different experiences. Some have been shielding, some working on the front line in hospitals and supermarkets, and some have been staying at home continuing with their education. The one thing I think services should prioritise in the next 6 months is listening to the experiences of young people. Young people have had a wide range of experiences during the pandemic, so a one-size-fits-all approach is not going to work. It is vital that if, for example, patients say they're too afraid to come to appointments in person, online video or telephone appointments are set up if this is appropriate. It is also important that these patients, who for months have been told going outside is very dangerous, receive the correct psychological support to help manage and hopefully reduce their anxiety.
When lockdown happened, I thought that I wouldn't have to go back to school. Whippy for me! Lockdown meant things changed. For me, like school and karate. Like I could never train. All I had to do was go back into my room. Going back to karate is good so I can train with my friends. So when we do the grading in belts, that when we've started the training and we've success in it, then we'll grade for it. And if we pass, then we get that next belt. Some things have to change back, like not washing our hands 5,000 times.
So, having brought so many incredible young people together, we then set out on another challenge. Over the last month, NHS trusts up and down the country have started planning for how they'll allocate their next round of resilience funds. So we wanted to make sure young people were represented in recovery plans going forward. And the way we wanted to do that was to take in as many voices as possible. With so many organisations like Girl Guiding, the Duke of Edinburgh Award and the Children's Parliament listening to young people, we wanted to read as many as we could. And to show how serious we were, we even taught an edgy artificial intelligence model to categorise stories by emotions and issues to analyse the trends. We aim to publish our findings really soon and share these with chief execs, boards and general head honchos of the NHS to show that they can plan ahead with young people in mind.
Okay, thanks very much. So Emma and Michael, we've had a couple more questions that have come in, and then also we've got some that have been sent in beforehand by young people. So I guess, Emma, one for you. What positive things do you think have happened that you've either seen or been involved in during COVID? Because it does seem like it's always bad news stories, particularly about young people.
Yeah, I think sort of with the latest headlines saying that it's young people causing the latest spike in Europe, it's quite easy to sort of just say young people, when actually it's really important that the blame doesn't get put on just a group of people. I was reading an article which said that 92% of those young people that they spoke to were stringently following the lockdown rules. So I think it's really important that young people don't all get tarnished with the same cloth when it comes to breaking the rules. I think it's also really important to remember that so many young people have been doing amazing volunteering during the lockdown. I know so many people, and myself included, have been working on projects such as writing government guidance and working with various charities, including RCPCH, to make sure that young people's voices are heard, and that we are helping in this pandemic.
Thanks, Emma. And Michael, there's one for you as well, just thinking about virtual appointments and everything being done online. What do you think children and young people feel about that? Or, you know, from your own personal experiences maybe, or from the experiences that you've read, do you think they're good things that we should keep, or do you think we, you know, what have you picked up?
Sure, so that's a great question, and I guess my experience of that is I had an orthodontist appointment that was meant to be my last appointment ever, and instead of going into the clinic, I was told that I should do it online. I was sent a link, and it was really weird having a camera and sort of using my phone to sort of show my teeth and ask whether everything was okay as a result. And I was amazed the fact my dentist and orthodontist were able to say that fortunately everything was fine. So I think part of the technology, it makes us go, wow, the fact that you can do such incredible things using technology. But of course, it's not the same as having that relationship with your doctor or dentist or orthodontist. And as a result, that's what I hope we'll be able to bridge in the future, whereby we can have a bit of that convenience, whereby we can just log on 10 minutes 5 minutes before and then talk to our doctor and be done with it, but also still maintain those relationships. And I hope that we can still sort of moving forward have both.
Fab, thank you. We're going to go now to Mike, who's going to just do a quick run through about some of the things that have changed innovation wise, but also to talk about some of the lessons or planning for the future.
Thank you, Emma. Thanks, Michael, and thank you, Emma, as well. So we're going to talk about innovations, and as has been raised quite a few times, telemedicine has been a big thing. And Michael, you talked about the benefits of it, and using telemedicine for virtual clinics is really helpful. But I've had problems with video connections like we've had today on today's webinar. We're always losing connections, and actually it's one of the things that we forget. It's an access issue. So those who've got good Wi-Fi, good video connections are perfect for video consultations when it's right for them at the right time. But many people have got poor Wi-Fi, poor connections, so actually it's not accessible. So video clinics can't fix everything, but they have been really helpful. The other things that have been changed is we can do home monitoring. So again, in my respiratory clinics, my patients now have lung function monitoring equipment at home, and they perform it at home and they send it down to me by email, which we can discuss in clinic, which is excellent. And as Jas mentioned, as a paediatric team itself, we do lots of virtual conferences and training events, virtual examinations. What's really new and has been really helpful is having joint consultations with your secondary care doctor and your GP together, or with your secondary care doctor and your tertiary care doctor. So the whole team is together. So lots of things have happened. We're learning from it. Some of these things will stay now, without question. So have the next slide, please. So we have to plan for the future. And as we've been saying today, and this is a message, we've got to work with children and young people. We need to get the message about what they need, what a good service looks like. And that really is key, and it's one of the strongest messages that I picked up over the last few months, whilst COVID has been so hectic for us all. Integration is vital. So we now work together. GPs secondary care doctors, tertiary care doctors, we can see you all together at the same time. So working together as one, making sure that the one person sees the right doctor in the right place at the right time, trying to avoid this toing and froing which is happening at the moment, but use the service correctly. Clinics themselves often no pre-planning. We might talk to the GP before we see you and then do a video consultation, so it's much smarter. We've got to think about the winter. We don't expect this winter to have a very big flu season, but we have to wait and see. But we have to think about how we're going to manage flu seasons with other infections and COVID as well. But the important thing is good communication. Webinars like this, sharing information, is going to be most important. Thank you. So finally from me, I think this is the most important message, is putting children at the heart of the recovery. We need to really recognise what Jas is saying and what Hannah's been saying, how superb, how excellent children have been, and young people helping the nation, doing what they've been told. It's now time for us to look after you. When we recover the NHS, children need to be at the heart of it. And this slide is from a statement which came from many charities, including Bernardo's and the RCPCH as well. Thank you.
Thank you, Mike, for picking up the things that have changed during COVID-19 and sharing some of your future plans. We've now got a few questions from those attending the session.
So, Mike, there's a question that's coming about thinking about consent and best interest through COVID. So how to best think about that or support that for children and young people going forward while we're working remotely and virtually. Okay.
So there isn't any reason why we can't consent to the majority of procedures over the phone if it's done in a supportive way. But some of the consent situations, particularly when there's a difficult procedure happening, a difficult operation, we'd probably like to have the whole family in the clinic. It's important that children take part in the consent process. What we don't want to happen is people being excluded by video consultations. Video consultations must be seen in the same way as clinic consultations. You're all seen there together. And Emma, can you ask me that question about the second part of that question again?
Yeah, it was the second part was just about best interest. So it kind of goes into that decision making, joint decision making, and making the right decisions for the best interest of the child during COVID.
Yeah. So during COVID, there was right at the beginning we thought, will health resources be limited? Which we had to think really what's the right thing for children, and what we wanted to make sure was that children received the same access to the healthcare they required. So we had lots of chats with various professionals, and we looked at discussions about how to ensure that best interest for children was maintained, and it has been all the way through. Moving again to consultations and consent, I think best interest is there when you're there making the decision with your family, and I don't want that to change.
Okay, thank you. Do you think, a question that came in beforehand, do you think there's any policies or procedures that we might need to put in place to protect vulnerable young people from a second wave or future pandemics?
Thanks, Emma. I think we do. But we have to be careful and very specific about which vulnerable children we're talking about, because there's two very important groups. So vulnerable children due to clinical concerns, and vulnerable children due to the situation they're living in. And I think both of those groups we need to be very aware of and look after. So for those clinically extremely vulnerable, and thank you again for discussing in questions earlier about shielding, we've worked very hard with many special societies covering many conditions that affect children, and making sure that only those children we really think need to be shielded are still would be shielded if there ever was a question for that to return again. Last time it came out, I think about 100,000 children received shielding letters through their parents. If there was to be another request to go back into shielding, then that will be down to probably 10 or 15% of that. But again, following on from what Hannah said and from what Jas said, even though children who are clinically extremely vulnerable, we're getting very few events where children who are extremely vulnerable actually been admitted to hospital and have any signs of illness. So even though we've been extra cautious for you, actually we still know that COVID for children tends to be a milder disease. Thank you.
Thanks, Mike. Right, over to Michael.
Perfect. So we're nearing the end at the moment, but your questions have been great and we just want them to keep on coming. So please don't hesitate to put them through the Q&A box and we'll hopefully then have lots more to answer.
So Michael, while you're on screen, one of the questions that came in was about if you had maybe a tip that services could think about in terms of getting, good health messaging out to young people. So what do you think would be a tip to share to services?
So in terms of outreach, I'd suggest that using social media and pursuing ways where children are on. So for instance, a lot of young people are spending time on Instagram, on Twitter, on Facebook. And so that's a great source of being able to reach out, but also through schools, through parent networks, where children indirectly receive their information during the summer. And then also, even more importantly, I would say that it's important for there to be, I guess, a branch whereby young people can access information regularly from health providers and that there is this regular discussion, not just once in a blue moon.
Yeah, thank you. Emma, I don't know if there's any tips that you think as well that services might be able to learn from?
I think for me, as someone who has been shielding, it's really important that services help young people to feel confident going outside again. For months, we've been told that if we leave our house, there's a chance that we could get really, really seriously ill. And although we know young people are less likely to get coronavirus and less likely to get it severely, there are still a lot of people who are very, very scared of getting it. So I think it's important that these emotions are listened to and that young people are spoken to about why they're feeling like this, and perhaps being able to create a plan of small steps of how to reduce that anxiety. I know that's what I'm currently doing, and it is really helping, sort of seeing a couple of new people every week, just to help people get that semblance of feeling safe when they go outside again.
Yeah, I think that's so important. I know we've talked about it in the projects that we've done about how we all rebuild after something like this, and it will take different amounts of time for different people, but to be all know that whatever's right for us will slowly and truly build up. Jas, I think that the next question is coming in for you. Hopefully you are still online as a presenter. If not, then one of the other fab doctors that have been with us today can help out. It was really a question that's come in from people that are just about to start on their medical career. What could be some good tips for F1s who have finished med school, they've got their first year as a foundation doctor, and just actually coming into the new normal? So it's different to what they'd been getting ready for. So who would like to take that one first from the doctors?
I don't mind. It's Hannah. I don't mind. So I think Jas might be having some internet trouble. So the first thing to say is welcome. Congratulations, you made it. I guess, it'll be interesting to see what the others think. My first top tip is the nurses are always right. So if in doubt, listen to everyone else. And the second thing, and I suppose this is particularly relevant for obviously I work with children and young people, but I think, to be honest, bears repeating, even if you're working in adult medicine in the widest senses, actually people's families tend to know them pretty well. So if a family member is saying, not happy, something's not right, my mum, aunt, whoever, daughter is not her normal self, actually take note, because they know them a lot better than you do.
Thanks. And Emma, shall I come in as well?
Yes, please.
So again, congratulations. It's a lovely place to be and you'll have a really exciting time. One of the top tips I would give is actually speak to each other. Speak to your colleagues at work, the guys and girls starting with you at the same time, because the worries and anxieties you're feeling, they're feeling the same as well. So if you can find time at the end of each day just to share some of your thoughts and reflections with those around you, you'll find it'll stay with you forever.
Lovely, thank you so much. And back to Hannah and Mike actually for the next one. So just a question's come in about how we make sure that services are accessible to disadvantaged children and young people and their families who I guess might not have some of the tech that we've all talked about, or might be coming from, you know, backgrounds where maybe they've got disabilities or different languages, or looked after children and young people.
I absolutely agree. I think that one of the first things to say, just by way of reassurance, is that we're all very conscious of that, conscious that for whatever reason it's not necessarily always easy to do a telephone review or a video consultation. I mean, I would say as the first thing is actually say that to whoever you talk to from the hospital, because quite often, certainly where I work, actually there is a degree of choice. So for people who feel that they would really rather not come to the hospital for logistical reasons, or indeed because, as Emma said, they still feel quite nervous about doing that, we can facilitate them doing a phone or a video review. But actually, if because of your family circumstance, actually you really would rather come in person, where possible, clinicians are really trying to facilitate that. So I would say just ask. And in terms of kind of wider access, I guess, look, you all will all know who your trusted adults are, whether that's your youth workers, whether that's your teachers, whether that's your GP. So reach out, because the chances are that you're not the only one feeling the way you're feeling, and actually they can help signpost you to the right place to make sure that you do get access to the services you need.
And Hannah, thank you. I'd echo that. If you want to see your doctor face to face, you must do that, because often the doctor might think you prefer a video consultation. Please just say to your parents, say to the doctor, actually I want to go and see them in the clinic, and we can make that available. And then the second thing is quite rightly about how to reach out to all these groups, all the vulnerable groups. During the peak of COVID, a lot of community healthcare workers, health visitors, etc., were pulled into the hospital. We've been really loud in trying to get that service back and running, because I think it's having those community the nursing teams around and available, able to go into homes, picking up those issues is really important. So I agree with Hannah that we're very, very aware of the situation. I think we have to be honest and say we haven't got it absolutely right yet, but I think there's a lot of work on this and we've not finished yet. Thank you.
Thank you. Right, so we've got a very quick question, last question for Emma and Michael, and then we'll be thinking about the wrap up and getting some of your thoughts on the session. So what do you think, Emma and Michael, is the thing that we need to do to make sure that children and young people aren't forgotten as we keep going forward? So whether that's in press conferences or planning or policy writing, what do you think we could be doing to make sure that they're not forgotten? Emma, do you want to go first?
Yeah, I think firstly it's just remembering that young people want to be involved. It's been said a lot of times that we are the generation of people that want to help people. We're very socially conscious. It's just making sure that that is harnessed, especially in a time when perhaps people who weren't quite as aware of the amazing work that the NHS does, it's now been pushed to the forefront of those people's minds. So I think it's about harnessing the enthusiasm and passion that's going on at the moment, and reaching out to charities such as RCPCH and Us, and also the hospital youth forums, because many big children's and adults hospitals around the country have them, and they are a great resource.
Thank you. Michael, have you got a last thought just before we go back to Emma to finish up?
Exactly. To build on that, the main thing is to stay relevant. And the way that young people can do that is, through 4 different ways. The first is through the publication of data showing that young people are falling through the cracks, because once you have that, you can identify that there is a problem and support that. And then the second step would be to share that with policymakers, to people in charge of NHS governance, that they have then the awareness of the problem, which they might not know and have beforehand. And then to have the third step would be to have young people actively campaign about it, whereby young people are such a big mobilizing force. And if they can share their anxieties, but also their hopes and aspirations for an NHS, that is exactly what we need. And then the final is to partner with lots of other organizations, whether it be other Royal Medical Colleges, whether it be other NGOs, charities, to make sure that both the successes and also the things we're still yet to achieve are amplified.
Excellent.
Yes, so in our sessions with And Us, we always end with a checkout, either to see how we felt during the session or to catch up on actions or next steps. If you could, please put one word in the chat box, Q&A, to describe how you're feeling about the session today. And for anyone that would like to access support about this or any other topics discussed today, you can get support from the services on the screen, which will also be included with your joining information and will be posted on social media straight after the session.
Lovely. So that slide's just about to come up with some of those support services. And then Michael.
Brilliant. And so I know that I've learned a lot, and I hope that you have too. So I just wanted to thank you so much to everyone joining us today and in future. Your questions and comments have made this Q&A fun and engaging. And thank you again to our speakers from RCPCH and Us, Mike, Jas and Hannah, for passing on your amazing experiences of being on the front lines. And for those of you that have joined us late, want to catch up on the speeches you've heard, or rewatch our mini Teams tech or unmuting meltdowns, fear not, because the live Q&A has been recorded and we made available on the RCPCH and Us YouTube in a few weeks. So again, I just want to thank you so much and wish you an amazing evening.